is Ferlin Christians, Chairperson of the Standing Committee of Public Accounts. Welcome to our meeting. I'm going to ask our members just to introduce themselves, and then we will ask the department to introduce themselves. With me is Mr. Dustin Davids. He's the procedural officer of this committee. Welcome to the meeting. Members, over to you for introductions and just to introduce yourselves. Thank you.
Good afternoon, Chair. I am Leon van Wyk. I'm a member of the Public Accounts Committee.
Good afternoon, everybody. I'm Benedicta van Minnen. I'm a member of the Public Accounts Committee.
Good afternoon, everybody. I'm Peter Johnson,
Peter.
member of SCOPA.
French Mbombo, good afternoon.
Good afternoon, I'm Pat Lecker, member of the Public Accounts Committee.
Is that all the members? I'll hand over to the department to introduce themselves. I see the HOD, Mr. McDonald.
Good afternoon, Chairperson and honourable members. I'm Robert MacDonald, Head of Department for Social Development. My MEC, I think, has tendered his apologies. He is on the road at the moment with the rest of the Provincial Executive in the Eden District and is unable to join. But the department is here, so I will ask them to introduce themselves, starting with Mr. Mzwandile Hewu, and then the other chief directors after that, and then the directors present. Thank you.
Thank you very much, HOD. Good afternoon to you, Chair, and the rest of the members. I'm Mzwandile Hewu. I'm the Chief Director responsible for Community and Partnership Development within the Department of Social Development. Thank you, Chair.
Good afternoon, Chairperson. It's Annelie van Reenen, and I am the Chief Director responsible for the 6 regions.
Chairperson and members and also colleagues, I'm Juan Smith. I'm the CFO for the department.
Good afternoon, Chairperson. I'm Gavin Miller. I'm the Director for Research and Information Management.
Good afternoon, Chairperson and HOD, Lionel Arnolds, Director, Community Development.
Good afternoon, Chairperson, members, as well as colleagues. Tasneem Rakib, Director, Supply Chain.
Good afternoon, Chairperson, HOD and colleagues. I'm Petrona van Wyk, Acting Director, Operational Management Support.
I think that is, yeah.
Good morning, Chairperson and honourable members. Bernard Lodgett, Head of Ministry in the Office of MEC Akulond.
Thank you very much. I think that's everybody. Thank you for the introductions. We have 2 presentations and then we have 2 letters. But the 2 presentations is the household hunger within the Western Cape and the food insecurity in the Western Cape. Now, when the committee sat down with the annual reports on page 93, there was the committee, we noted the increased household hunger within the Western Cape, and that risk factor has gone from 9, that's a high, to 12, that's extreme. So we have that 2 presentations, and I think those 2 will go together. The household hunger within the Western Cape and the food insecurity in the West, that 2 will go together. Then we will then ask questions on that, and then I think Mrs. Rakib will then take over with private security contracts. She sent us the letter, and also we got the letter from Ms. Nadia Ibrahim from Provincial Treasury, because they do the transversal security procurement. But before we, HOD, if you can just do some introductory remarks and then just appoint the person that will do the presentation on the household hunger and food insecurity. and then I'll give the members opportunity to ask some questions after that before we go to the procurement. Thank you very much, HOD.
Thank you very much, Chairperson, and thank you for making the time for us this afternoon. And we hope that we can cover the areas of concern as far as possible. I think the Department of Social Development's work in the space of food security needs to be viewed in the context of the provincial government as a whole, but also in the context of what is happening across different spheres of government and the NGO sector and the private sector. So social development, in a sense, has a particular role to play in relation to food security. And we very much are filling in the gaps where there are specific needs that are not met by other forms of support for food security in the province. So some of the private sector, of course, is the biggest driver of food security. And then there are the social welfare nets such as SASSA that has a significantly bigger budget than social development for social security. And then there is the school feeding schemes that the provincial government runs, and the food gardens that the Department of Agriculture in the province is running. And then recently, there's also been the establishment of an interministerial committee and transversal work group on food security in the province that is spearheaded by the MEC for Health and Wellness in the province, and social development is part of that group as well. So I think it's important to see what we are doing in the context of the bigger picture, because we are a small department, but we do fill in where the other forms of social security and food security can't reach. So particularly where people are in far-flung corners of the province, where they are struggling to access SASSA support, for example, or when there is a disaster and there's a need for emergency relief, and the current capacity of SASSA to assist along with other role players is not sufficient, then we can step in there as well. So we fill in the gaps where the other systems can't quite reach. And I think that's the way that we've tailored and designed our systems. I think also to mention as well that the levers of food security in the province are probably much bigger in the NGO sector than government. We certainly saw that during the COVID period, where the NGO sector stepped in and actually assisted more people than even government could. And those NGOs are still operational, maybe not to the same degree, but there's still a lot of food relief and food support being pushed out by the NGO sector in the province. So again, it's we're not working alone. I think it would be useful perhaps for us to first present the analysis presentation that has been done by Mr. Gavin Miller. So I'll ask him to lead with that presentation. And then afterwards, I will then ask Mr. Zwandile Hewu to come in with a presentation on what we are doing in social development specifically. So if that's in order with you, Chairperson, I'll ask Mr. Miller to proceed first, and then followed by Mr. Hewu. So I'll just check, Mr. Miller, are you ready?
Thank you, HUD. Yes, I am ready to proceed. I'm not sure whether my presentation is visible yet, though.
We've got your screen.
You can see the screen. Okay, so I'm just waiting for the presentation to load then. It should...
Okay,
I think it's loaded. Yes, sorry, there seems to be a bit of a delay on the network today.
You can proceed.
Good afternoon, Chairperson, members. I want to do a very short presentation just on data that is available. Unfortunately, we do not have a comprehensive and transversal data set on hunger in the province. Data sets that are available are the General Household Survey, which is an annual survey conducted by Statistics South Africa, and I'll be specifically referring to the 2023 survey, which is the latest one for which we have data. I'll also just briefly look at some trends from 2018 to 23 from the Household Survey, and then also Census 22. censuses every 10 years. So this will be what was enumerated in 22. There are some limitations in the data sets. Census, we know there was a huge undercount, which impacts on the quality of the data. There's no sub-municipal level data. Previous censuses, we were able to drill right down to a sub-place, which is equivalent to a suburb. This last census, no sub-municipal data has been released. There's no economic data. Economic data we could often also use to equate to vulnerability in communities. We don't have that data. Census data is all self-reported, so it very much depends on how the person felt on the day they were enumerated, whether they were going to report hunger or not. With the general household survey, it's a very small sample size at provincial level, so you cannot drill down too much. The only level we have is provincial level, nothing lower than provincial level, and it is also self-reported data. Okay, then just looking at the census, there was a question on on adults within households. So it's at a household level. So it's the numbers reported there are households. Is how many households are there adults experiencing hunger? And we can see that there's 57% that's saying never. Unspecified is 25, probably also due to the fact that there was a high undercount, but also because some questions are often skipped by people. In total, though, it is still a significant number of people that are experiencing hunger. For children, we see the situation is not much better. It's actually slightly worse. There's still a large number of unspecified. If we look at children, there's 27,800 households that are saying they always experience hunger. So that's only 1% of the households. It's still a large number of children. If we look at the general household surveys, and this one I'm going to first look at 23, there are a number of questions that relate to hunger. The first question I want to report on, in the past 12 months, did any adult go hungry because there wasn't enough food? And we see that 80% are saying never. 1% are saying that it is, or 6% are saying seldom, 11% sometimes, and 2% often. So it is again quite a significant number, and the 1% that are saying always. That is for adults. For children, we're seeing that the never is slightly higher. We do know that in many households the adults prioritize the children, but still the seldom, which is 6%, the sometimes 11%, and the often 2%, always luckily 0%, is still quite a significant number. If we look at households that are worried about food, they may be enough to eat now, but maybe there's sufficient lack of resources for them to be worried about not having food. We see that there's a 19% that are saying yes. So it's 1/5 of the households are saying yes, they are worried. There was a question on households that skipped meals during the last 12 months. Was there any time anyone in the household skipped a meal because there was not enough money to get food? And 13% said yes. And of that 13%, 66% said it happened for more than 5 days in the past 30 days. So maybe on a global scale, the 13% is not so high. If we look at the right-hand side of this graph, see that it is quite deep. So the hunger might not be as widespread as in some of the other provinces. Certainly, what we are seeing from the data is if where there is hunger, it is quite deep. And it's the same in this slide. We look at during the past 12 months, was there a time when your household ran out of food because of lack of money? Again, it's 13%. And again, we see that of that 13%, 63% is saying it happened more than 5 days in the past month. So again, showing us the depth of the hunger. Then there was a question on, was there a time when you or others in your household were hungry but did not eat because there was not enough money for food? You see that's 9%. And then households where they reported not eating the whole day, it was 7%. So we see the numbers are maybe not exceptionally high if we look at the, just as a percentage, but if we were to convert that percentage to number of persons, then it is still very significant. Perhaps more significant is for us to just look at some of the trends, though. And I'm just looking at some of the questions, and this is persons that ran out of money to buy food. If you look at the 6 years recorded there, we see that in general, there's a slight decrease. We see the increase here during the COVID period. Otherwise, the long-term trend is showing that it is improving. The next slide is again on the households that ran out of money to buy food. Again, yeah, we see in the COVID period there was an increase, but the long-term trend is that the situation is improving. And then just to look again at the depth, households that ran out of money to buy food for 5 days or more in the past 30 days. Yes, we see the COVID blip up again, but it seems as though long-term, again, we've got a slight increase. So although there might be less people that are experiencing hunger over the period, it certainly does appear that those that are experiencing hunger are experiencing more hunger. So that is something we need to take care of going forward. Thank you, Chair. That is all I have to present.
Thank you very much, Mr. Miller. I think also to mention one of the reasons the risk escalates in the Western Cape Department of Social Development's risk register and in the annual report is also to do with the fact that our budget has been shrinking and our ability to meet the need is therefore becoming limited. So although the state of food insecurity may not be deteriorating, in fact, in some ways it is actually improving slowly. With the budget limitations, it means we have less ability to reach the need, and that is the big risk for us, and that's the source of the increased risk. I'll hand over now to Mr. Hewu, with your permission, Chair.
Please go ahead.
Thank you very much, Chair. Thank you very much, HOD. I just want to check if you can see my screen.
Yes, we can, Mr. Hewu.
Okay. Thank you very much, Chair and honorable members. After the summary that the HOD gave, I think it follows very well into the presentation that we are going to give. Just to put it on slideshow. Thank you very much. Chair, I've got, with the load shedding, I've got my colleague here, Lionel. Should I experience difficulties, my colleague Lionel will take over. Am I audible, Chair?
100%.
Yes. Thank you very much. Chair, this is the outline of the presentation, starting with the purpose and ending with the showing cases, the projects that were running from 2024-25 up to the current year. We are here to brief the committee on the development of a mechanism and implementation thereof to mitigate the impact of the risk of increased household hunger in many communities within the Western Cape. In line with what the summary that the HOD gave, we've got 5 areas in which we intervene to provide food relief. One important one is we fund community nutrition. We fund NPOs who run community nutrition and development centers across the province. We also fund community-based kitchens that are run by the NPOs who also provide food to some parts of the province. We fund NPOs providing emergency food relief during disasters and post-disasters. Within our programs, particularly in the social welfare space, we provide food as part of the functioning of the program in old age homes, in shelters for the homeless, in residential care, child and youth care centers. We also provide food there. We also, as an emergency measure, procure food parcels, which we keep in store, so that we provide to those individuals and households that are experiencing hunger. So in the community nutrition and development centers and the kitchens, during 2024-25 financial year, the department funded 54 NPOs, which are managing 102 community nutrition and development centers, as well as 16 community-based kitchens. In the current financial year, we will be funding 55 NPOs, which will also be supported by 14 community-based kitchens. CNDCs provide food relief to registered beneficiaries, and that food is provided 5 days, Monday to Friday. And in that intervention, we are reaching more than 10,000 beneficiaries per month. In the community-based kitchens, they provide food relief to beneficiaries. In some instances, 2 days a week, some 3, some instances 4 days a week. That intervention is reaching more than 8,000 beneficiaries per month. And we wish to confirm that 80% of the beneficiaries that are targeted and reached are mostly women and in some cases, children under 5. In the community nutrition and development centers and kitchen, these meals are equally assured in partnership with the Department of Health by creating a prescribed and standardized meal plan. This is done to address the food standards and ensuring that the nutritional value of the meal is upheld for the positive child development outcomes. The department ensures regular monitoring of compliance to norms and standards in terms of the prescribed occupational health and safety standards of the kitchens and the feeding centers across the province. We do this to ensure that we prevent harmful food-related diseases and possible poisoning. We felt important, Chair, to give you a regional spread of all these community nutrition and development centers and community kitchens we're talking about. As you can see, Chair, in each and every municipal districts, DSD is present, and it's either by a CNDC or by a community-based kitchen. For 2024-25, we have provided those allocations up to the tune of 47 million. Got reduced a little bit due to the budget constraints for the current year, but we're still providing the relief in those areas up to the tune of 46 million. And we do this funding the organizations, as I have explained in the prior slide. This is just a pie chart indicating the percentage of what is spent in each and every corner that has been explained in the regional allocation slide. It continues, and then for 2025-26, still the difference is not much. You will see that both in 2024 and 2025, Metro South is the highest allocated area. The reason being that historically, the Metro South has gotten many NGOs, NPOs that are working and are compliant. When the time for applications comes, most of the NPOs that are compliant and are in good standing appear to be in that part of the metro. Also, we felt that we needed to indicate our rural and metro allocation. You will note that we are very biased towards the rural areas because there you do not find many NPOs as we do in the metros. That biasness continues during 2025-26. As you can see that our allocation, 56% of it goes to the rural areas. We are not only about the provision of food, we also provide opportunities which economically uplift the standards of the participating beneficiaries. In each CNDCs, there are cooks, there are program officers, there are interns, and through the budget, we make provision so that those people receive a stipend. 2024-25, we reached 163 of those to assist these individuals to put food on the table at their households. And as we know that most of our families are extended families. So if there's somebody who's receiving an income within that family, that income, in majority of instances, it is used to put food on the table and reduce hunger. 2025-26, still the cooks, program officers, and interns, we've increased the number of the work opportunities provided to 249. We are sharing our achievements in terms of the annual performance plan for 2024-25. I will just concentrate on the fourth quarter. Fourth quarter, we targeted more than 22,000 beneficiaries, and we have reached those beneficiaries on a non-cumulative basis. Then the food parcels that we have spoken of. DST keeps a limited stock of food parcels for individuals and households who have no means due to unemployment and difficult economic conditions, and who are unable to access other forms of social relief. These individuals in need of food are identified in communities and are referred to DST to make food requests. The relevant local office of DST assesses eligibility and make a recommendation for the allocation of food parcels to qualifying beneficiaries. Then DST allocates the food parcels from head office to DST local offices for distribution to the clients who have made the request. For the year 2024-25, we have made available 2,458 food parcels, which were distributed province-wide. Our Sustainable Livelihood project is not only about the cooked meals and providing food to the beneficiaries. We've investigated other sustainable self-reliant opportunities. So we found the opportunities like the baking and sewing and garden, bakery, barista making, which is coffee making. And we had 5 NPOs that we funded. Oasis in the Eden Caro, Van Reinsdorp, Ebenezer is in Beaufort West, and Zanisake is in Kukuletu, and Hout Bay Christian Center, it was in Hout Bay. Unfortunately, this NPO had to close due to extortion activities in the Hout Bay area. We are still looking at the replacement NPO to ensure that the beneficiaries in this area are not left disadvantaged because of what is happening there. For the current year, we will continue to fund these projects that we have mentioned, and to the tune of 1.1 million. And these are the projects that are using beneficiaries so that we can move them from vulnerability to sustainable development. Sewing, they make garments, they sell these garments so that at least they are able to assist themselves as individuals and also to assist the project to remain sustainable. The food provision in other DST-funded centers during 2024-25, in addition to the food relief provided by our program, Sustainable Livelihood, we provide food in the DST-funded centers. For example, 141 old age homes. I have provided food to 5,317 older persons, 3 meals per day for 7 days a week. 163 senior clubs have made food available to more than 8,000 older persons that are participating. 40 disabled homes have made food available to 1,627 people with disabilities. 64 daycare centers who have made food available to more than 2,000 children. and with intellectual disabilities. 47 protective workshops, making food available to 2,177 persons with disabilities. 43 shelters, making food to more than 2,300 homeless people available. 26 program sites and 17 drop-in centers. They have provided food to 10,505 children. 85 NGOs in the after-school care space, making food available to about 6,000 children. 47 NPOs, child and youth care centers, who have provided food to more than 2,250 beneficiaries. DST-owned centers, also providing food to about 931 beneficiaries. 25 victim empowerment shelters, the GBV space, providing food to 42 beneficiaries. 5 NPOs in the substance abuse space, may also providing food for 664 beneficiaries. Yes, Chair, there are challenges and the impact of hunger. It affects the communities. In some instances, the reduction of human potential for economic activities, people cannot go and seek work because they are hungry, increased mortality and the hunger, delays in the provision of services, increased hardships, generally in the citizens. Of course, it increases the potential for crime and other social ills. As the HOD indicated, Chair, the question of hunger, it's not a challenge that impacts DST alone. It is a challenge that needs to be addressed by all government departments working with other stakeholders. The challenges require collaboration and partnerships amongst the like-minded stakeholders to give effect to the fight against hunger. In this regard, DST collaborates with the following stakeholders: the Western Cape Education Department, that provides school nutrition services, reaching a number of schools, feeding a number of children. Without this support, they would have gone home hungry. NPOs that provide food, whether it's cooked or they provide dry ingredients to communities, we work with them. Humanitarian relief organizations that are providing food in vulnerable communities, particularly during disasters and post-disaster. We also work with churches and faith-based organizations who are distributing food in vulnerable parts of many communities and households. Of course, social relief interventions of SASSA with the 350, it also helps with the beneficiary to be able to buy food and deal with the challenge of hunger. These are some of the photos, pictures of the programs, the projects that we have indicated that we are supporting in Kukuletu, and then the one, this one is the beneficiaries in the skills training program and the bakery, and then this one is the one in Hout Bay, which is on the right hand side is the barista making, and then on the left hand side is the sewing project. With that, Chair, thank you very much for the opportunity, and the presentation will end there. Thank you very much. I will stop sharing.
Thank you very much for the two presentations. I'm now going to allow our members to ask questions on the presentations, and then we will go over to the procurement. Members, is there any questions from your side? I don't see any hands. Is there hands? Checking. No, is there no questions?
There is, Chair. I'm trying to unmute myself.
Go ahead, Member Pedlecker, go ahead.
Thank you, Chair. I want to double check. Is it on both presentation or just the one?
No, on both, Member Lecker, both.
All right. Thank you, Chair. First one on the food insecurity in the Western Cape.
Chair, I want to understand in terms of the data that has been used, which communities were interviewed and what was the criteria that was used to select these communities based on the questions that has been asked. Two, Chairperson, in terms of this specific criteria, I noticed that in slide, I'm not sure what page is this, where it says, Chair, it is not applicable if there is no child in the household. And there it says about 9.3% of the people claim that they go to hunger. And I would like to know if there's this category of unspecified people, which is 25%. That's the category that has been used. I want to know why is it termed as unspecified? And also, Chair, in the same slide, I want to go to a question in respect to those that says they experience hunger always. What significant applications have been used in terms of identifying once again this household where they say they experience household? In the same vein, Chairperson, all I want to know is communities, what sorts of communities were interviewed? Was it in the middle class or was it basically in the working class communities? I'll then proceed to the second slide, Chairperson. The second slide, Chairperson, which talks to the services that are offered by DSG, where it says 55 NPOs and 14 community kitchens. And I want to ask, what is the criteria used to select these NPOs and community kitchens that is used? Now, when it comes to Chairperson, still I don't know what slide is this, but it starts with the DST regional allocations. And I want to ask Chairperson if that data is available. The one organization with 5 community kitchens, what was the criteria used to select that one organization? Then moving forward again, Chair, there's a pie chart. The pie chart, Chairperson, talks to 56% is in the rural areas. And I must say, I'm happy that there is consideration on the rural communities. But I want to ask, out of the 56% from the rural communities, what are the numbers in terms of the next page, which talk to the socio-economic impact? Out of the 122 cooks, what is a shared number for the rural communities? And I want to ask, out of that 56% allocation, what is the numbers in terms of the funding that has been given to those community kitchen, if that type of information is available? Then moving forward, Chair, I must say I appreciate the efforts where people are given skills so that they are able to sustain themselves as well. But in that, I want to ask Chairperson, there's mention that in Hout Bay, there's been problems of extortion. And there's an attempt to look for an organization that will take over from that. If that was my understanding, if it is correct, I'm subject to correction, Chair. I want to get an understanding, Chairperson. Is it possible that this kind of service could also be spread into other communities as well? Or was it just a kind of piloted projects in Houtbeek. Thank you, Chair.
Thank you very much, Member Lecker. I don't see any other hands. I'm checking again. There's no other hands. And then HOD, I'm going to hand over to you, and then you can direct the questions, whoever must answer it. Over to you, HOD.
Thank you very much, Chairperson. I will ask Mr. Miller to assist with the questions on the which communities were interviewed and what criteria were used for the survey data and the census data. And also the question about why the term unspecified is used, and then the third question also about what has been used to identify households where they said they're always experiencing hunger, and in which communities. So I'll ask Mr. Miller to answer those first three questions, and then the remaining four questions I will ask Mr. Harewood to answer, which starts with the question around the criteria used for selecting NPOs and kitchens for funding, and the other questions that follow. So I'll handle it that way. Thanks, Chair. So over to Mr. Miller first.
Thank you, HOD. Thank you, Chair. Minister Mbalaka, just on the slide first, on the data sources and the limitations, the first source that was used was the census. The census theoretically counts everybody from all communities. We do know that there was a huge undercount in the Western Cape. But there are statistical methods that are used to adjust for the undercount. But all communities, low, middle, and higher communities were counted. If I can jump to the slide on the this is the adults, and this is the children experiencing hunger, the similar categories. The not applicable, this would mean on this particular slide, there were 31,599 households that reported that there were no adults in the household. So that would be the not applicable. The unspecified is where that household did not answer this particular question in the census. It was skipped for whatever reason. And the same would apply here. Yeah, we have 9.3% of the households reported that there were no children in the household, so it's not applicable. And again, there were 620,000 households that skipped this question for whatever reason. It may be linked to the fact that of the undercount, and Stats SA wasn't then obviously able to allocate any particular data to that adjusted number. It is not possible from the census data to identify a specific household. When Statistics South Africa do their data collection, it's all provided anonymously. There's information such as income, employment status, etc. So there's a lot of personal information collected. So it is all done in terms of papaya. So there is no way of identifying any household after the fact. So census and household survey is not a means of identifying households to provide services after, but it is a useful means for us to try and identify and then also monitor and look at the trends in communities. Now, unfortunately, with the census released this year, the data is only down to municipal level. So the variables that I reported on, we are only able to measure down to or analyze down to municipal level. And on the general household survey, only at provincial level. The sample size is too small for us, although all communities were included. Stats South Africa have a sample methodology that ensures that all sorts of communities are included in the sample. Households from almost all enumeration areas are included in the sample. It's not possible for us to analyze at anything lower than provincial level. Thank you.
Thank you very much, Mr. Miller. I think I should also add to that the Department of Health also keeps data on the malnutrition and wasting cases that present at their clinics and hospitals, which can also be used as a supplement to the data that has been presented here by social development. They, of course, are the custodians of that data, and so they do share it with us when we engage on a transversal level. So I can say that there is that additional data. The figures for malnutrition and wasting and stunting are contained in their survey on wasting and stunting, and they have presented that previously. I think the area-based data is a little bit more detailed as well, because they get it from their local clinics. So it may be a particularly good information in the metro area where there's different drainage sites for communities that are being served by the various health facilities. So that information is also used to guide us. The rates of malnutrition that have been presented to us actually indicate that the biggest issue is obesity, resulting from poor nutrition. So the quality of the nutrition was actually the biggest issue that was flagged in the survey done by Health. And that is indicative of people having limited income and choosing cheap food options that are mostly carbohydrate based with very few nutrients. And so people are developing various health issues because they are eating food that is not sufficiently nutritious. So there is a lot of obesity coming through the system as a result of that, and these malnutrition and wasting figures are lower, but still there are still concerns on that end as well. I will now ask Mr. Haywood to respond to the remaining 4 questions from the honourable member.
Thank you, Jody. I will just share quickly the presentation. Thank you very much, Honourable Lecker. Can we confirm if we can see the slide I'm showing, Chair?
Not yet,
no.
Mr. Haywood.
Not yet.
Mr. Haywood, the committee does have a copy of the presentation. Maybe if you can just refer them to the slide number.
Okay.
In the interest of time.
In the interest of time, thank you very much. That will assist. That will be. I will start. Honourable Lecker, I will start with slide 7, where there's the DSD regional allocation. I think this is the slide you are referring to. The criteria that the department uses to select NPOs, we issue a call for funding proposals. Organizations apply. Most of the organizations in the food space who apply are community nutrition and development centers. Others are just organizations that are in the food provision space. So those who meet the criteria during the selection process then are recommended for funding. Some are still kitchen. Our idea is those that meet our criteria to be community nutrition and development centers, then they will be migrated to be CNTCs. So at the moment, they are community-based kitchens that have been funded because they meet the criteria that has been set up. So that is what is happening in terms of identifying the organizations. And secondly, the same slide 7 has got the breakdown of the financial allocations to this area. Like in the Eden Carroll space, 12 million has been allocated to them for 14 community-based kitchens, as well as for the 19 feeding sites. So that is the breakdown, and it is the percentage. In slide 8, it just expresses the percentage of that allocation. So as the rural and slide 10 and 11, the rural and the metro split, that 58 million, that is 58%, is just a percentage allocation of the financial breakdown that has been shown on slide 7. So then just that, the breakdown that we've got here is the regional breakdown. It's not per NPO. We do have the breakdown if it's required per NPO so that the committee can actually see the breakdown. The NPO with the 5 community kitchens, in some instances, a CNDC in Gugulethu, for instance, or Mitchell's Plain, will want to serve the beneficiaries that are staying 3-4 kilometers away from their kitchen. So what they do, they collaborate with a community kitchen that is in Lendagier, for instance, and then that community kitchen will be used as a feeding site for that CNDC that has been funded. They use that community kitchen so that the people close by that community kitchen can go there and receive their food. So I hope that explains, Honorable Reckon, the question of the 1 NPO and the 14 and the 5 community kitchens in terms of the question that you have asked, because it is in Metro South, for instance. In Metro South, there's one organization with 5 community kitchens, which means there is one organization that we are funding, which is supported by 5 community kitchens in terms of the area of distribution and the closeness of the proximity of the food to the people that are intended to receive it. I hope that is clear. Thank you very much, Chair.
Mr. Hayward, also to mention maybe that the selection of the NGOs through the department's NGO funding policy, which is a standardized approach for us for funding allocations. Mr. Hayward, the additional questions that were asked is the spread of personnel between rural, especially cooks, between rural and metro areas, whether we have that sort of information. I'm assuming we could probably provide that to the committee in writing because I know you don't have the breakdown with you. And then the split of rural versus urban in terms of the funding. The last question was about the extortion in Hout Bay and the fact that we had an NPO that decided to withdraw from the community that it was serving due to extortion. The question was whether we found another organization yet to take over, and also whether this service can be spread into other communities as well that was being rendered in Hout Bay.
Yeah, thank you, Jody. I'm sorry about that one of the split for the cooks. We do have the split, and we will make it available to the committee. That is where these cooks and program officers and interns, which NPOs employs this and where they are. In relation to the Hout Bay, before the end of the financial year, we ask an organization that we are currently funding to support just the feeding part of what happened in Hout Bay. What is happening in Hout Bay, the sewing project, they also had a bakery project. It's the project that we are also funding in other areas. So in other, like for instance, Beaufort West, we are funding the same projects, but funding a different organization. I am not sure if Lionel, my colleague, is here, just to indicate if we specifically have been able in the new funding to close that gap, or those funds have been taken to another organization in another region. Mr. Arnold, if you can help with that.
Yes, thank you, Mr. Ewu and Chairperson. You are correct. The first issue, of course, for us to consider when there's a lapse in service delivery is to consider alternative organizations to provide the service. And you are correct. We do have a service provider that are providing food in Hout Bay. However, this does not include the skills development component, as the whole center, of course, was well, the services at that center came to a standstill. We are, of course, looking at how best we can use elements of the skills development projects that we're able to take to other areas to extend that. But for now, that service is only restricted to food provision at this point due to the issues of extortion and the extent that the organization were not able to proceed with those projects. Thank you.
Thank you very much. Back to you, HOD. Thank you.
Thank you, colleagues. Chairperson, I think that's the end of the questions that I have written down. Thanks.
Yeah, thank you, HOD. That's. I'm just going to check for Member Lecker. That's most probably a follow-up that Member Lecker's got. There's no other members' hands up, so Member Lecker, you can go ahead.
Thank you, Chair. Thank you to the colleagues on the responses. Chair, I hear the responses, and I think I remain with a concern, Chair. Since we have already been told that there has been issues of undercount. And with that, Chair, I want to understand in terms of the increased household hunger, to address that, what are the steps available, or are there any processes that are being implemented in order to attend to that? And I also want to check, Chairperson, I think I read somewhere, can't remember where, in one of the government information centers, that there has been some kind of funding from the presidency, which provides for food insecurities. And with that, Chair, I want to understand with my second question, whether in terms of partnership or in terms of funds that could be accessed, has there been an attempt by the provincial department to source out some of the funds that are available in the presidency? Because I'm more concerned with households that go hungry, but I'm also very much concerned and disturbed by the fact that there's been undercount. So I want to understand what strategies are there to address such issues. Thank you, Chair.
Thank you very much, Member Lecker. I don't see any other hands. It's only Member Lecker. And HOD, we're just referring to DSD, what they are doing. We know you're just part of feeding, but I think our concern as a committee was that, the increased household hunger, what is DSD doing, and was there a presidential assistance? If you can just answer that. Thank you. There's no other hands there, members. Nobody's struggling to unmute or not? No, thank you. HOD, over to you.
Thank you very much, Chairperson. I think the undercount issue is a Census SA issue, and they have indicated, I think, that they're going to try to avoid something like this in future. I don't know the exact details because it affected census data across the board, not only in the food security space, but in terms of the count of the total population in the province and various other information as well. So I don't know, Mr. Miller, whether you've got any information on what the proposed way forward was from Census SA on that issue. But I mean, we can only really speak on hearsay at this stage. So it's difficult for us to say with certainty how they're going to address this going forward. Mr. Miller, do you want to add?
Yes, thanks, HOD. Chair, yes, and Ms. Lecker, there was a huge undercount, and Stats South Africa are trying to address that going forward. The main reason, the area where the biggest undercount is in the gated communities. They are not easily accessible by the census enumerators, but we also know that the gated communities are not necessarily the highest priority when it comes to food security. But also just to say that because we know that census is not the most reliable when it comes to food security, we make use of other data sources. So that's also why I made reference to the General Household Survey, where there is no big undercount, where although it's only a survey, in other words, a sample, which is not very big, it gives us a better indication of the trends over time, which is useful. And then as our HOD has referred to Department of Health, that there's malnutrition data and stunting data, we would look at that. Then there's Department of Agriculture that also has their food gardens and other data. And there are other, from time to time, there's like the NIDS-CRAM studies that were done during the COVID period, and other studies by other research houses that we would consult. So we wouldn't put all our eggs in one basket. We would look at as many data sources as we can to get a picture. Thank you.
Thank you, Mr. Miller. I think then also to add that, of course, social development's own offices, as well as the NGOs that we fund, as well as the Western Cape Food Forum, which is a forum of over 200 NGOs that became operational in the COVID disaster, they all provide inputs as well of what they're experiencing on the ground, and provide us with some idea where the pressure points are, and where the need for services is greatest in the province as well. So we do use data from and feedback from our own staff on the ground and the NGO sector on the ground as an additional source of information. Now that isn't formalized into a survey in the way that the Census SA data is, but it does assist us when we identify where the needs are, because sometimes high-level data also doesn't always tell you exactly where the need is greatest, and our local officers often know they've got a lot of people coming to them asking for help and so on, and they know also where we need to have food provision. So we also use that guidance to also assist us. I think in terms of the question about the presidency, I mean, there is the G20 initiative around food security that has established a food security task force, and our government via the presidency is part of that, but there hasn't been any allocations of funding to provinces yet linked to that. So that doesn't rule it out in future, but thus far we haven't received any specific allocations from the national government for food security. I think one of the new initiatives we have started as well is that we've been funding as of this year, or actually as of late last financial year in the last quarter after the adjustment period, we've been funding humanitarian relief organizations to also step in and assist in disasters with food relief for the first few days, especially within the first day or so, while waiting for other forms of relief to arrive. So that emergency first response, we've been funding organizations to assist with that and provide food during that period as well, because we've identified a gap there, particularly given that SASA has to wait for name lists from the municipality before they can activate their procured service providers to bring food, and that can take up to 3 days. and of course they were put into that position by or adverse audit findings of their previous method, which was an immediate release of food before they had name lists, and the Auditor General raised findings on that. So we've now stepped into the gap that's created by funding organizations that can respond immediately. So alongside others who do it of their own accord, like Gift of the Givers, we are funding organizations that can assist in that space, because we can't expect Gift of the Givers or others to do this on their own. It's a very big task sometimes, particularly where we have a very large disaster like the flooding last year. So I think the other aspect as well is, now that we have the interministerial committee established on food security in the province, there is a review underway of all the data we have available, as well as all the different initiatives that are in place to assist with alleviating food security, and we'll be identifying where there are gaps in the system, and seeing how we can address those gaps as a collective in the provincial government. And then we would approach Treasury with proposals for funding of those initiatives where they are required. So that is underway, and it will overhaul, I think, our transversal approach, and TSD will have a role in that space. We will have to determine what our specific role is. I think that's still to be determined, but it will be a priority area in this current new 5-year term, and it's that work is already underway. Thanks, Chair.
Thank you very much, HOD. Is there other follow-up questions or further questions? I don't see any hands. Thank you very much for that. There's no further questions on the foods insecurity in the Western Cape. So we're going to move over to the procurement of security. And that we received a letter from Ms. Rakip, and also we saw the letter of Ms. Ibrahim of Provincial Treasury Asset Management. So if we can just go through that, HOD, and then I think that will be it. Over to you, HOD.
Thank you very much, Chairperson. I will then hand over to the CFO and Ms. Rakip to brief the committee, and then we can take questions afterwards.
Thank you, HOD. Thank you, Chairperson and members. Yeah, as indicated in the 2023-24 financial year, during our deliberations and debriefing in terms of the annual report, then the matter that was raised was the fact that the department extended so many contracts through procurement by other means, and as you also alluded, Chairperson, it is the private security services. And then the other question was also around why the department could not timelessly procure such contracts. In our response, as you alluded to, Ms. Rakip then also provided that memo, as well as Ms. Nadia Ibrahim, for we would also like to not just cover the 23-24 financial year, but also the 24-25 financial year, and also proceeding forward, so that we can also give context in this regard. So without that, Chairperson, I'm going to ask Ms. Rakip then to take us through the response. Thank you.
Thank you very much, CFO. Good morning, good afternoon again. Can you see my screen?
Yes, we can.
Okay, thank you very much. Mrs. Ibrahim from the Provincial Treasury is online, and she will support the response when necessary. So firstly, thank you for the question. I'll be specifically responding to why the department extended a significant amount of contracts through procurement by other means, and why we could not timelessly procure or extend such contracts. So just in terms of context from a legislative perspective, the National Treasury prescribed procurement by other means, and in our case as reported in the annual report, it relates to extensions of contracts, limited bidding, as well as emergency procurement. National Treasury has prescribed this as accepted methods of procurement. And you'll see in the letter, we basically indicated that National Treasury Regulation 16A64 allows an accounting officer to procure via other means if it is impractical to invite competitive bids, provided that the reasons for deviating from inviting competitive bids is recorded. And in all instances, we can confirm in the annual report, the accounting officer utilized this legislative provision, as well as the other pieces of legislation emanating from the National Treasury regulations, which includes a National Treasury instruction note, our Provincial Treasury instructions, our department's AOS, as well as delegations. And in all instances, we have complied with the necessary prescripts. So in the main, procurement by other means for our department relates to the extension of our existing contracts at that time with service provider for security services as indicated, and then also following that the limited bids that we have procured with the same service providers for security services. Now, as already mentioned, we are participating in the provincial transversal contract for security services that is facilitated and arranged by the Provincial Treasury. So the initial transversal contract that was entered into, or that was effective in 2019, was a framework agreement contract under which the department then entered into its own contracts with service providers that were compliant and on the framework agreement. Prior to the expiry of that transversal contract at the time, the Provincial Treasury started a new bidding process. However, in process, the Bid Evaluation Committee as well as the Adjudication Committee had recommended that the bid be cancelled due to some issues or challenges in the specification that could affect the bid's award, and that was in the main related to industry compliance requirements as well as certain bid conditions. That was later supported or approved by the Head of Treasury, the cancellation, as well as supported by legal services. So as a result, the Provincial Treasury, as I've indicated, have then extended the framework agreement at that time for a period of 9 months. And they then advised our department as well as the other departments who are party to the contract that we could either extend our existing contracts up to the 31st of March at the same terms and conditions via our own process in line with the extension of the transversal contract, or we could invite a new contract from the transversal contract or utilize emergency delegations. So service delivery being the primary objective in terms of security services, in terms of protecting our facilities, staff, and vulnerable communities, the department had made the decision to extend the current, at that time, security contracts with the service providers who were already on site in line with the PT's transversal contract, because it was administratively advantageous as well as cost effective, given that it was only for, at that time, a 9-month period. So in essence, the decision was made in terms of ensuring continuity of service, avoiding higher costs if we had to go via an open bid or even a new contract from the framework agreement. And then we also mitigated the risk of ad hoc procurement, because this is a highly complex commodity that we have procured, and it requires rigorous vetting from service providers and companies. So extending our existing contracts with companies or service providers that have already met the compliance requirements was key for us in terms of ensuring service delivery at our facilities and our sites. So as I've indicated, again, we've done it in line with the legislative provisions. Then with regards to the limited bids, now although the question didn't necessarily focus on the limited bids, it's also another method of procurement, and it's also related to private security services. So we, at that stage then, that was in December 2023. We received a letter from the Provincial Treasury, again stating that there are further delays in the finalization of the transversal tender, and that was basically related to them having to manage, or us as a province having to manage, the risks based on the lessons learned from the previous cancelled bid process, as well as the fact that this is a complex commodity, and there was also ongoing litigation related to the first contract that the Provincial Treasury was dealing with. Also bearing in mind that this is a transversal contract, so when your bid spec evaluation and adjudication committee meetings convene, the Provincial Treasury is reliant on the availability of such departments and actually pulling different members of different departments together to come to a consensus in terms of how the transversal bid specification should look. So at that stage then, the Provincial Treasury did not extend the prior framework agreement because they've already exceeded the initial 3-year contract had come to an end, and they've already extended it. So what they've advised the department is then we could follow a limited bidding process. So a bidding process, albeit to one service provider. So we followed our stringent internal process as it relates to limited bidding. And limited bidding essentially means that you go to one service provider if there's sufficient motivation to do so, which we had in terms of, again, ensuring service continuity for a critical commodity that is highly complex, and particularly in terms of protecting our facilities, our staff, as well as vulnerable communities. And then also for the fact, again, that should we have gone via any other open bidding process, the rigorous vetting of the service providers is, as I said, it's a very complex exercise, and we were assured as a department that these service providers could provide the service at that stage as they were compliant. So that was for 23-24. So in the 24-25 financial year, it's not necessarily written up, but I'm going to explain. We had then again had to extend our contracts, and Nadia is here if she wants to provide further input on that. With regards to the limited bids that we entered into, and that is basically there were further delays in the transversal tender process that relates to the same reasons as I've mentioned earlier on. So there were 2 sets of extensions. It was for a period of 6 months initially, so it would have been from 1 October to the 31st of 1 October, I think, to the 31st of March. And then subsequent to that, for this financial year, we have then, so for 25-26, we've have entered into another extension with the same service providers. And just to give feedback then, in process, what we have agreed with the Provincial Treasury in finalizing these tenders. So the Department of Social Development has 2 sets of sites, basically. One, which is our regions, which has the basic standard security service requirements. And then we have our secure care centers who need more specialized services. So what we had agreed with the Provincial Treasury is that for the specialized services, we'll follow our own tender process, meaning Department of Social Development will do it by themselves in terms of their policy. But the Provincial Treasury would partner with us. So we had a member on our bid specification committee. And then for our other sites, we will then participate in the transversal tender. So the transversal tender at this stage has been advertised, and it is closing on the 16th of May. So we are hopeful in the sense that the extension ended into for the period up until June would be the last extension. Obviously, if there's risks in the process, we will need to mitigate it in terms of how the market responds. If there's any issues of risk that we determine in process, we will then have to make a decision, an informed decision in terms of the way forward. Then with regards to the departmental process as it relates to the secure care centres, that specification has been finalised and in table at our bid adjudication committee. It is en route to the accounting officer for approval, after which it will be advertised. So that's where we are in terms of the security and the extensions related to that. My letter also covers then the contract extension for nursing services, but I think that's fairly straightforward. We are using a contract from the Department of Health and Wellness for nursing personnel. They've extended their contract, and therefore, by implication, we are also party to that extension. And then my written response then also covers the emergency procurement at that stage, which related to an emergency that occurred in Eden, Karoo, due to severe weather that caused electricity outages in several towns. So there were disruptions which were unforeseen, which caused thousands of households to be in dire need of emergency food relief. So there was an impact on the households, particularly because of electricity. This was an unforeseen situation, and therefore it was classified as an emergency, and therefore we invoked at that stage our emergency procurement policy and delegations to basically meet the need at that stage, which was the 3,000 food parcels that we have procured. So that's the end of my presentation. Mrs. Ibrahim, if there's anything that you may wish to add with regards to the security, then you may do so now. Thank you, Chairperson.
Fine, Tasneem, I'll deal with the questions, if there are any.
No, thank you very much. Thank you very much for the presentation.
Thank you, Manager.
Members, is there questions to the presentation? I see Member Pat Lecker's hand is up, and there's no other hand. So, Member Lecker, over to you.
No, thank you, Chair. Chair, I may have not been in a better position to capture everything, but firstly, I want to understand, has the security tender, okay, what is the actual date for the end of the extension that has been given to the current companies? Because I believe from the 1st of October to the 31st of March, there was also an extension again for the same company. So I want to understand first, what is now the new date for the end of this contract? But also, Chair, maybe this is for future purposes, because I'm trying to think if there's an extension of a contract by means of limited bidding. For me, I think there's a chance that the company may not perform optimally. I'm using the word may not perform optimally because there is no pressure for competition. So I want to understand, is there a thinking perhaps to do away maybe with limited bidding? Because at the end of the day, the issue of competition may not be the only negative outcome of this kind of choice of limited bidding. So I want to understand, what is the thinking? Is this going to continue? But also, Chair, in terms of identifying the best value, in terms of the opportunity for comprehensive comparison, what is the thinking around that? Thank you, Chair.
Thank you very much, Member Lecker. HOD.
Thank you, Chair. I'll ask Ms. Rakip to respond to those questions. Thank you.
Thank you, HOD. So, Member Lekker, the end of the contract is 30th of September 2025, and that relates to the extension of the contract for limited bidding as reported in the 23-24 financial year. Then with regards to your question around the service providers not performing. So when we look at the extension of contract, right? Performance of the contractors is a consideration that the department takes into account when extending a contract. So if there is non-performance, we will deal with it throughout the duration of the contract. But if we need to extend it, that is one of the considerations that we will take into account before we extend. So if the department determines that the performance of the supplier has been poor, we would then look at an alternative mechanism, which the PT has basically also put in the letter, which would have been either to use another service provider on the transversal contract or to use emergency procurement. So performance is always assessed when extending contracts. Then with regards to your question in terms of doing away with limited bidding, so just for clarity purposes, the limited bidding that we have done is an interim measure whilst we are finalizing our open bidding process. And the only reason, as I've indicated, why we utilize limited bidding is because we have surety that the service providers are able to render the services, and as indicated, they have performed for the duration of the contract. If they have not performed, we would not have either extended the contract or done a new process with them via limited bidding. We would have assessed another alternative in terms of ensuring service continuity. Thank you, Chairperson.
Thank you very much. Is that it? Thank you very much for the comprehensive answer there. Members, I don't see any hands. There's no hands. I think, Mr. McDonald, do you want to do some concluding remarks?
Thank you very much, Chairperson. Just to say thank you very much to the committee and to yourself, Chairperson, as we always appreciate the insights and input from the committee in terms of the risk areas of the department, and it certainly also gives us a chance to reflect on what we are doing from a different perspective. So thank you for making the time and giving us the opportunity to present on these important issues that are impacting our department at the moment. I think the risk around the food insecurity and the ability of the department to respond to it has alleviated slightly for us, given the budget turned out better for the department than we expected. But we remain a little bit uncertain now that the budget is going to be revisited nationally. And depending on the outcome of that, it could then impact our outlook in terms of our risk assessment of our ability to respond to food insecurity. Because if it does result in a budget cut and we have to cut back on those services, then it does increase the risk in our view. So we are not entirely out of the woods, but it is currently looking less severe than we had expected initially when we first received our projections for the 25-26 financial year. But yeah, we will see what happens now with the revision, and I expect we will have a chance to update the committee next time we appear. So thank you very much, Chair, and thank you to my colleagues as well for their presentations and their inputs on these matters.
No, thank you, Mr. McDonald, HOD, and thank you for the officials that presented. Just from the committee side, thank you very much for you and what the department is doing. We appreciate your hard work, and we know it's, trying circumstances. We will never be able to, everybody is doing their bit, but as a department, you'll never be able to deliver because of the financial constraints we have. But thank you for the presentation and giving us some insight for the questions we had. I think it was well answered. you may be excused, and thank you for being with us this afternoon.
Thank you, Chairperson.
Thank you very much. Bye-bye.
Thank you.
Thank you, Chair.
Thank
Bye,
you.
everyone.
Thank you. Bye-bye.
Thank you. Thank you very much.
Thank you. Bye-bye.
Bye-bye. Bye-bye. Bye-bye.
Thank you.
Members,
Goodbye.
thank you. Bye-bye.
Bye.
Bye-bye. Members, we're just going to do the minutes of the 7th of May, but also just to inform you that we did pay our affiliation fees. That's required annually. So that's has been paid, and we are, I don't know if you remember when we just came into Scopa, there was a 2-year that we had to pay, and that was paid, and now we were billed and we paid our amount, and that's done. So that is just the matters from the affiliation fees. But that's that, and then we're just going to do our minutes of the 7th of May, and that I'm going to leave to Mr. Davids. He's got it on the screen. Over to you.
Thank you, Chairperson. Thank you, honourable members. Chair, this is through you, Chair. This is just the minutes, Chair, of last week, Wednesday's meeting, Chairperson. As you can see, Chair, it's the draft meeting and draft meeting minutes until it is considered and adopted by this committee. Chairperson, the members that were in attendance, there was an apology from Member Pondlo, and then Member Masipa also sat in, Chairperson. Chairperson, there was only Dr. Klute and Dr. Angeletti, the two that briefed the committee. And then, Chairperson, it is just where they briefed the committee, Chair. And then the PAC minutes of the 23rd of April that was also considered and adopted, Chairperson. Chairperson, these were the resolutions of last week, Chairperson. It was refined a little bit, fine-tuned a little bit to make sense. For the Department of Health, Chairperson. So it is a copy of the department's user asset management plan, Chairperson. And if there should be any additional breakdowns of geographical areas, including financial values of the 40 billion infrastructure backlog during the MTF period that the committee members requested. The cost breakdown of the expenditures of Klipfontein and Bell Hospitals, Chair, including the exact location and earth numbers. And then as well, Chair, the details of incidences of the EMS entering hotspot areas and the MOU between the department and security services. And then, Chair, it was basically 2 reports whether the department could actually identify the ownership of the vacant pieces of land, which was next to Dr. Abdurrahman Clinic, including NY 108 and NY 18, Chairperson. And then, Chair, just a report on the feedback of the recent interactions between the National and Western Cape Department of Health. Chair, I believe that was Member Petrus's matter. We indicated that there was a dispute between National and the Provincial Departments of Health and Wellness. And the committee decided that instead of requesting that National come brief us, let us first get a report on what the feedback were. And then if it necessitates, then the committee will then engage with National and the Provincial Department of Health to see how the committee can assist. Chair, so the meeting finished at 11:15, Chair.
Well, thank you very much, Mr. Davids. Mr. Member Van Wyk.
No, that seems good. Those minutes. To me, I think if that's acceptable to committee, I will propose.
Thank you.
Those minutes.
Thank you very much, Member Van Wyk. Is there a seconder?
I move to second, Chair.
Thank you very much, Member Lekker. Thank you very much for that. So that minutes is accepted. I just now forgot to ask, is there any further, Member Lekker, you asked quite a number of questions. Were there any further information that you wanted from DSD, or did they answer you satisfactorily, or any other member, if there was anything that you wanted further from them? But I'm just giving you the opportunity, Member Lekker, because you've asked the questions. Are you satisfied? Was there outstanding information that you required?
The breakdown, Chair, the breakdown of the skilled people that are employed, I requested for that, which I think must form part of the resolution because they said
Yes.
they don't have.
Yes.
There was something also that I couldn't get a response to. I'll come back to you, Chair.
Yeah, we're doing the resolutions now. That's why I'm asking you. So that we're on resolutions now. Mr. David, did you capture anything there? Go ahead.
Yes, Chairperson. Just to assist Member Lekker, it was basically the department indicating that they can give us feedback on the staff, as Member Lekker said, with regards to the kitchens operating, the rural versus the urban, as well as the kitchen funding by the department, the various kitchen fundings, rural and urban in the Western Cape, Chair. That's the two documents they said that they can forward to the committee.
Thank you very much. Member Lekker, does that cover you?
Yes, the last one, Chair, is on the humanitarian relief provided for by the department. I maybe just to get information as to what is the criteria that they use in identifying these areas, and is this a duplication of what other, like what SASSA provides in areas where there are disasters? Is it a duplication or it's one and the same thing? Thank you.
Thank you. Member Wendy Kaiser-Valanda, you asked something about the president. Can you just unmute and just ask that question that we just put it on record? Oh, I'm muted. I spoke. Member Kaiser-Valanda, do you just want to? I see in the chat box you've got something about presidential assistance. Do you just want to put it on the record quickly? Thank you.
Good afternoon, Chair. My apologies. Am I audible?
You are. You can go ahead.
Thank you very much, Chair. Chair, there was mention made during the meeting, specifically to the presentation of food insecurity, that there might be some sort of commitment made through presidential funding to assist provinces. Can we perhaps seek for some more information on that, Chairperson?
Yeah, I mean, we can do that. The HOD did say there was mention of that, but there was no allocation. So how do we phrase that? Do we, because he said there was a mention of presidential assistance, but there was no allocation given. So how do we phrase that?
Chairperson, I think it's with your indulgence and that of the committee, I think it's worthwhile for us to explore whether there will be such perhaps in future budget years, Chairperson, because that will greatly assist provinces. But also, Chair, if you wish to perhaps refer this matter for further follow-up by the Standing Committee of Social Development, I guess that is something that can also be explored, Chair.
Yeah, I think that is the way to go, Member Kaiser-Valanda. I think that is the way. We can just ask the Standing Committee to follow up social. I think it's in their domain, so we will just then send it a letter. Procedural office will just forward a letter to just let the Standing Committee then run with that, and because that is no longer in our domain. Thank you very much.
Appreciate. Thank you, Chair.
Thank you. Members, is there anything else? Mr. Davids, is there something else that I've left out? Are we done?
Yes, Chair. That is yes, Chair. Everything has been handled, Chairperson.
Thank you very much, members. Thank you for the meeting. Thank you for your time. The meeting is adjourned. Thank you very much.